How's it going, guys? We have a difficult question for Biochem Pharm. For some of you think this is easy. It's always subjective, right? So we're giving oxymetazoline as a nasal spray, and we're just asking you the molecular impact. And so oxymetazoline, phenylephrine, and midodrine are the three straight up alpha-1 agonists you need to know for USMLE. Obviously, there are other drugs that have alpha-1 agonistic effects in addition to other MOAs such as epinephrine, norepinephrine. But when we talk about just straight up alpha-1 agonists, oxymetazoline, phenylephrine, and midodrine. Oxymetazoline and phenylephrine in particular can be used for nasal decongestion because if you're constricting vessels, that's what alpha-1 does, right? Okay, so if you gave it peripherally, you constrict peripheral arterioles, you could increase blood pressure. But when you give it intranasally, that constrictive effect will decrease hydrostatic pressure in the nasal mucosal capillaries, and that leads to decreased transitation of fluid into the interstitium and relief of your nasal decongestion. So phenylephrine and oxymetazoline in particular, midodrine tends to be more like surgical related, but in addition to nasal decongestion, there's two other points I want you to know. You can technically give these agents to decrease nosebleeds. So you do simple cotton packing first, but if they ask you for which agent given intranasally could theoretically decrease blood flow, oxymetazoline, midodrine, phenylephrine. All right, the other thing you need to know is something called rhinitis medicamentosa, which is if you've got a head cold, that's what coryza means, head cold, and you use alpha-1 intranasal alpha-1 agonist to relieve your nasal decongestion or relieve your nasal congestion. If you use it too many times throughout the day for around 5 days plus, you can get what's called rebound nasal congestion, referred to as rhinitis medicamentosa. They ask that on USMLE also, okay, where they want you to know oxymetazoline and phenylephrine are the ones that do it classically. All right, so if given alpha-1 agonist, what's going to be the molecular effect? Choice A, correct answer. The way you're going to answer this is you just got to know some mnemonics for your G-alpha, S, I, and Q, G proteins. So we'll start with G-alpha Q. So have 1 or 3 M&Ms, histamine 1, alpha-1, vasopressin 1, muscarinic 1, muscarinic 3. So that's what we have here. We got alpha-1 agonist. So if we agonize G-alpha Q, we're going to increase IP3 and DAG. If you antagonize, then you'd have the opposite effect. You would decrease IP3 and GAG. GAG, what the fuck am I saying? DAG. Okay, so that's our first mnemonic for G-alpha Q. Your second one is MAD2s. Muscarinic 2, alpha-2, dopamine 2. That's for the G-alpha I G protein, where if you agonize that, you decrease CAMP. Okay? So if you gave clonidine, for instance, or methyldopa, which are alpha-2 agonists, agonize G-alpha I and you decrease CAMP. This is an example. So you got to be able to answer these questions. Know the drug, know the receptor, agonist, antagonist, and what's it going to do in terms of molecular impact. So we said those two mnemonics, have 1 or 3 M&Ms for G-alpha Q, MAD2s for G-alpha I. Then you say, well, what have we not said yet? We haven't said, so all the other ones, they're going to be G-alpha S. So beta 1, beta 2, vasopressin 2, dopamine 1, right? So this is how we know the G proteins. And they like beta blockers in particular for decreasing CAMP. And glucagon increases CAMP, the way you know that. All right, so for this question, your take home is that oxymetazoline, phenylephrine, and midodrine are alpha-1 agonists, and oxymetazoline, phenylephrine in particular, nasal decongestion. They can decrease nasal bleeding, theoretically, and they can cause rhinitis medicamentosa. You know the deal. I'm going to make more content on my subscription. Appreciate your time. That's it.